And Nora O'Donnell, representing some other pharmaceutical giant, no less, gave Bill Gates a hard time about the Moderna trials.
Moderna vaccines sound concerning. We looked. After the second dose, at least 80% of participants experienced a systemic side effect, ranging from severe chills to fevers. So, are these vaccines safe?
Well, the FDA, not being pressured, will look hard at that. The FDA is the gold standard of regulators, and their current guidance on this, if they stick with that, is very, very appropriate. You know, the side effects were not super severe. That is, it didn't cause permanent health problems for the things that they.
Does this sound like a guy who was expecting a different line of questioning, or perhaps a less aggressive?
Well, definitely, yeah. Well, when he starts going all the time, which is doing,
he's struggling. He's struggling.
He is
man.
having trouble calculating what to say.
And the it was a grade 3 injury that most people who had side effects, what they suffered. Grade 3 is 5 is dead. Grade 4 is life-threatening. Grade 3 is probably not pleasant.
Health problems for the things that Moderna did have to go with a fairly high dose. And so, to get the antibodies, some of the other vaccines are able to go with lower doses to get responses that are pretty high, including the J&J and the Pfizer. And so there's a lot of characteristics of these vaccines. It's great that we have multiple of them that are going out there. And yes, I think
you know the data better than I do. But the data show that everybody with a high...
Hey, that's Dr. Bill to you, Nora. Who do you think you are?
You know the data better than I do. But the data showed that everybody with a high dose had a side effect.
Yeah, but some of that is not dramatic, where it's just super painful. But yes,
it's not dramatic. It's just super painful.
Not painful.
Not painful. Super. And while he's telling this, he's rubbing his arm with his hand, like, wow, that must be really painful. But it's not very dramatic.
But the data showed that everybody with a high dose had a side effect.
Yeah, but some of that is not dramatic, where it's just super painful. But yes, we need to make sure there's not severe side effects. The FDA, I think, will do a good job of that, despite the pressure.
And then finally, she wraps it up with, what can we expect from this thing? Is it good forever? I mean, it's a vaccine, right? We take it, we're good.
How many doses of the vaccine will we need?
Well, none of the vaccines at this point appear like they'll work with a single dose. That was the hope at the very beginning. Maybe one of them, particularly in the second generation, won't surprise us. We hope just 2, although in the elderly, sometimes it takes more. And so making sure we have lots of elderly people in the trial will give us that data.
Woo! Lots of elderly people. Yay! Just look at how well they did with COVID. Come on, elderly people, step right up.
Jeez.
But this has to be...
That's an embarrassment. He shouldn't even go on the air.
But I think this had to... What does Nora know? This had to be a competing pharmaceutical corporation saying,
No, okay, you got one of your big advertisers. You got a couple of them, but you got one of them.
Let's say Pfizer. Pfizer. Just say Pfizer.
Okay, let's just say it's Pfizer. And Pfizer's seeing what's going on with the ink and all that. Have been going for this other thing. And they bring their top sales guy in, the guy who does the $1 billion a year. And he says, hey, can we talk a little bit about, because I want to give you guys some insight into what's going on. And they sit down with the news director and probably a couple of reporters, and they says, we're going to give you a briefing on, and this happens all the time in all industries. It happens in tech for sure. They take you down. They say, and they give you a full presentation of why this thing's a piece of crap. It's not going to work. It's a stock play. There's just a bunch of people going to make a lot of money on the stock going up and down. And then here's the kind of results they've been getting, because you have your competitive research. You have the results the other guys have gotten. You know what they are. It's not a secret. And you start throwing the stuff at them. And then you say, and here's the kind of questions you might want to ask Bill.
Exactly. Here's one. Ask him about it not working and the side effects. I love his answer. Super painful.
It's not bad. It's just super painful.
What are you complaining about, Nora? What's your problem?
You got to take more than one of these shots. It's like H1N1. Remember that they had to have the two shots.
Yeah.
Everybody got bent out of shape. Okay, we can make it one shot. Wait a minute. If you had to have two shots, how do you suddenly make it one shot? How does that work?
And meanwhile,